Welcome back, and you've been listening to Health Tech Talk. I am Ben Chodor. We're broadcasting live at 640 WGST on the iHeartRadio network and streaming worldwide on the iHeartRadio network. We had a great first segment. The second segment is going to be just as good. With me is Dr. Katrina Firlik. She is the Chief Medical Officer and co-founder of HealthPrize Technology. I mean, how can anything be more exciting than having a guest on with the name of the company, HealthPrize, right? The show is Health Tech Talk. We're all about the crossroads between healthcare and technology, and what's better than a company that's about healthcare and there's a prize involved. I'm thinking Cracker Jacks, but it has nothing to do with it. We're going to dig really deep into the company. I just got to tell you a little bit about Dr. Katrina. She is the Chief Medical Officer and co-founder of HealthPrize Technologies. Prior to founding HealthPrize, Katrina was a neurosurgeon, or she still is a neurosurgeon, in private practice in Greenwich Hospital in Greenwich, Connecticut. She's on the clinical faculty of Yale University School of Medicine. Besides that, she has written books. She has been reviewed by numerous magazines. She's been on CNN, Fox, MSNBC, countless locations. She is truly an expert in this space. Doc, welcome to the show. I hope you're having a good day.
I am. Thanks for inviting me, Ben.
I am very excited to have you on the show. Hey, first, I asked my last guest, how someone went from being a doctor to working at Deloitte, at a huge accounting firm. So I'm going to ask you the same question. How does a doctor end up founding a company and starting a company?
Well, I really understood the problem that HealthPrize is trying to solve, and that problem is motivating people to stick with their medications. And as a practicing surgeon, I often saw the downstream problems that occur from people not taking care of themselves. And so I was inspired to co-found a company back in 2009 to try to make a dent in this problem, and really inspired by my own experience with patients and kind of feeling like there was more I should be doing to prevent the problems from happening in the first place.
So let me ask you this. So it's funny, our last Dr. Morris, our last guest, when he did the Deloitte survey, they found out of the consumer survey that, approximately 50% or so patients don't adhere to their medication. Why is this such an epidemic?
Yeah, it's interesting. The problem is a lot more extensive than you might think at first. Just to kind of expound on those statistics, just if you take an example like hypertension, for example, you go to your doctor, he or she says you have high blood pressure. It turns out that when that doctor writes the prescription, about 20% of patients never fill the prescription even once. And then of those that do, within the first year, about half stop refilling, and so are off therapy altogether. So really what it leads to is a kind of an epidemic of very poorly controlled chronic disease that leads to a lot of unnecessary and preventable spending. So that's really the heart of the problem, and it's actually a fascinating problem because there are so many reasons for it. And that's what we've really tried to dig into at HealthPrize, and we've looked at the problem through a different lens than the typical adherence company has in the past.
Okay, so for my audience at home, a large part of my audience, our investor community, this is a business show, but there's also a lot of the consumer. There's people at home who might not be taking their medicine. So how does HealthPrize work, company-wise, or if I was participating in HealthPrize, just what's the basis?
Sure. So what HealthPrize does is it motivates people to stick with their medication through a number of different ways. So first, we educate patients, which is obviously key towards the intrinsic motivation required to stick with your medication. But what's different about HealthPrize is that we also reward patients, literally reward them with points, and those points are then redeemable for prizes that would be anything from an iTunes or Starbucks or Amazon gift card to healthy rewards like a pedometer or a cookbook or exercise equipment, to charitable donations. And you might think that's kind of odd, and that's kind of very consumery for healthcare and almost sounds like too much fun for healthcare. And where this came from is looking at the problem in a different way. So most adherence companies used reminders or various forms of cost reduction because the lens they were looking through was people don't take their medication because they cost too much or because they forget. And those certainly are reasons, particularly the cost reason. But what we feel is a bigger problem is what's called a present bias, which is what a behavioral economist would explain as, the same reason people don't save enough for retirement. And that is, it's hard to do something today when the benefit is potentially years down the line. So when you're taking your hypertension pill, you get absolutely no benefit from doing that today. And in fact, there's probably no benefit this week, this month. The goal is to prevent, say, a heart attack or a stroke potentially years down the line.
Exactly.
So that's a real psychological challenge, is to do something today when the benefit is long-term. That's why we use the short-term rewards with HealthPrize to get you over that short-term barrier.
So besides the reward, so I understand that if I do this, I'm going to get this, but how do you get them to do it? Besides the basic education, how's the technology work? Is it an app? Is it a website I go to? How's the messaging coming to me, and how am I putting the messaging back into the system?
Sure. It's a digital platform, so it's both online and mobile. So whatever the patient chooses, it could, you can use it on your laptop, use it on your mobile phone, and for every form of interaction that the patient has, whether it's checking in with us and saying I took my medication, whether it's refilling your medication, and we actually verify every refill, whether it's taking a quiz or a survey, or opening what we call the Daily Fortune, which is a short form of education. Every time the patient engages in any of those activities, they earn points. And those points are earned immediately. Again, we're all about the immediate gratification, because that's what's lacking in taking a chronic medication. So every form of interaction comes with the earning of immediate points. And more than that, we vary the number of points. You don't know if you're going to get 5 points or 50 points. That kind of piques your curiosity and makes you come back to the site to see what you earned. And so there's multiple different levers. Different patients respond to different elements of the program, and that's what's kind of exciting.
I love it. You've gamified it for fun, but also for results. Mm-hmm. So what's the feedback? So someone who's participating in it, I'm going to assume if you're going to participate, then chances are you're probably going to hear better. But were you surprised by the results, or were they what you expected?
Yeah, we have been favorably surprised by the results. Not only the objective results, but some of the subjective feedback we've received from patients. In general, we have the average person logging in, interacting with the program about 4 times a week, which maybe doesn't sound like a lot for, if you're comparing it to Facebook, but it's a heck of a lot when you're comparing it to healthcare programs. Getting someone to engage with a healthcare digital platform is difficult, and so we have very high levels of engagement. But what's been most gratifying to me is to get the feedback from patients, and we had one patient say that literally, she said having a chronic condition isn't fun, it's depressing, and this program gave me something to look forward to. And so it's that fun factor, giving you something fun, something that doesn't remind you that you're a patient, something that rewards you. And that's kind of the enhancement of the patient experience that we're really after.
Right, that's the magic pill of it, right? So I've got the disease, I have to take the medication, I'm going to do it anyway, but at least I'm not constantly thinking about the reason I'm doing it. It's getting me involved, and at the same time, it's reminding me. So the audience listening at home, so yeah. How do they get involved? Does it only come from my provider or my payer, or is your customer the consumer?
Yeah, our customer, well, it's rolled out in different programs. So you don't engage with a program called HealthPrize per se. We're the company, and what HealthPrize does is we then customize different programs for different patient groups, and even different medications. So, for example, you might be on a HealthPrize program for your hypertension for a specific medication, and you would enroll either at your doctor's office, or potentially if you're already involved in some sort of online program for that medication, you may be invited to join the program. So, eventually we'll roll it out on a larger basis to the general public. But for the moment, we have multiple different programs in multiple different chronic conditions. We have hypertension, high cholesterol. We're moving into the specialty conditions as well, because what's interesting is the medication and non-adherence problem is not just for hypertension and diabetes, but it's actually a cause of blindness for people who don't take their drops for glaucoma. In chronic cancer conditions like chronic myeloid leukemia, for example, there's a serious adherence problem. So even in conditions you wouldn't expect, there's an adherence problem that leads to poor outcomes.
This is great. So Doctor, I have to take a break. We're going to come back in a couple minutes. I have a bunch of questions to ask you. I want to remind the audience that you're listening to Health Tech Talk. With me is Dr. Katrina Firlik. She is the Chief Medical Officer and co-founder of HealthPrize, a really cool company. You're going to want to come back for the second segment of this segment. And I want to remind everyone that we are being broadcast on 640 WGST, on the worldwide, on the iHeartRadio network. I want to give a special shout-out to 1-800-Public Relations for all their PR and media support, and to everyone at Stream VPG for all their help, especially John in the booth. John, thank you so much for all your help. And now let's take a break, and we'll be back.
What are you doing?
I'm turning this hedge into a dolphin-shaped topiary.
But this house isn't yours. In fact, I just showed it to you.
Oh, I'm gonna buy it.
Softly confident.
Well, I am an excellent candidate for a home loan. I pulled an 809 FICO score at Experian.com, so getting a mortgage is merely a formality. What do you think I should do with this other hedge? A giraffe?
Get your credit swagger on. Become a member of Experian Credit Tracker and find out your FICO score powered by Experian. FICO scores are used in 90% of credit decisions.
Hi, folks. Alan Thicke here, and you've probably heard, maybe from me, that if you owe the IRS money, they can do some scary things. Garnish your wages, levy your bank account, even seize your home or business. You add on the penalties and interest, and getting out of debt can seem impossible. Back taxes are for real. It's not a game. But the game changes when you have a team of tax experts on your side. The professionals at Optima Tax Relief can immediately protect you from aggressive collections. And for a limited time, the IRS is offering a tax debt forgiveness program. It's called the Fresh Start Initiative. With the help of Optima, you may qualify for a settlement that saves you thousands. Nobody knows the game better than the Optima team. Don't wait till it's game over. Let their experts coach you through this. It's a win-win. Call for your free consultation.
Call 800-354-2840. 800-354-2840. 800-354-2840. Some restrictions apply. For complete details, please visit OptimaTaxRelief.com.
Hi, everybody. The racing guy, Pat Patterson, here for Brandt. You know that winning on the track means managing your equipment and track conditions every lap. For the American farmers, success is also about managing the ever-changing variables of nature. Brandt partners with the American farmer every day and has been since 1953. Learn more about the winning spirit of Brandt and the role that they play globally in agriculture online at Brandt.co. Brandt, take control.
Buying a car can be the worst. Scotty from the Power Morning Show. Unless you're using TrueCar.com, they're helping you save time and money. Two things we all wish we had more of. Helping you to never overpay. Users see an average savings of over $3,200 off MSRP. It's a pretty simple three-step process. First, you go to TrueCar.com and find out what others paid for the same car you're looking for. Second, register at TrueCar.com to see your upfront pricing information and lock in your savings certificate. And third, it's simple. Just print out your certificate and take it to the TrueCar certified dealer for a better, hassle-free car buying experience. Don't buy a car without using TrueCar.com.
Are you landscaping, installing a fence, or maybe even a mailbox? Whatever the project, call Georgia 811 before starting any digging on your property. By law, everyone, including homeowners, must contact Georgia 811 at least 48 hours before beginning any digging. Even if it's a small project, it's best to call Georgia 811 to protect yourself and your home. Simply dial 811 or visit Georgia811.com. Safe digging starts when you call Georgia 811. It's everyone's responsibility, and it begins with you.
Hi, folks. Alan Thicke here, and you've probably heard, maybe from me, that if you owe the IRS money, they can do some scary things. Garnish your wages, levy your bank account, even seize your home or business. You add on the penalties and interest, and getting out of debt can seem impossible. Back taxes are for real. It's not a game. But the game changes when you have a team of tax experts on your side. The professionals at Optima Tax Relief can immediately protect you from aggressive collections. And for a limited time, the IRS is offering a tax debt forgiveness program. It's called the Fresh Start Initiative. With the help of Optima, you may qualify for a settlement that saves you thousands. Nobody knows the game better than the Optima team. Don't wait till it's game over. Let their experts coach you through this. It's a win-win. Call for your free consultation.
Call 800-798-2477. That's 800-798-2477. 800-798-2477. Some restrictions apply. For complete details, please visit OptimaTaxRelief.com.
Welcome back, and if you're just tuning in, you're listening to Health Tech Talk. I'm Ben Chodor, and we're broadcasting from the iHeartRadio studios at 640 WGST and broadcasting worldwide on the iHeartRadio network. With me is Dr. Katrina Firlik. She is the Chief Medical Officer and co-founder of HealthPrize Technology. This is an incredible company that basically rewards you for taking your medications and staying on top of your adherence, which to me is the most amazing thing, because one of the facts that we gave before is, 50-some-odd% of people who get a script given to them, so a prescription, don't fulfill it. So finding ways to keep people healthier. So we were talking about this in the last segment, but Doc, I got to guess that providers, insurers, employers, pharma companies, PBMs, the whole gamut of everyone in this space must love what HealthPrize is doing.
Yeah, and Ben, that's what's great about the business that we're in at HealthPrize, is that it's a win pretty much for all constituencies in healthcare, and that's pretty rare. So if you can motivate patients to stick with important prescription medications to prevent the downstream effects of chronic disease, it really helps everybody, primarily the patient, obviously. But it also helps insurance companies because those patients will be less expensive over time. It helps employers for the same reason. In an obvious way, it helps pharmaceutical companies, PBMs, which are pharmacy benefit managers, as well as pharmacies. So really the entire network of industries stands to benefit from this problem, from solving this problem, and so that's why there is a lot of interest. The trick is to figure out, in the beginning we had to decide who to sell to and how to sell them, and what exactly we were selling, but the nice thing is that everybody does benefit from patients sticking with their medications long term.
Right, it's the business of the technology. So let me ask you a question. Since this is a business show, how does HealthPrize get paid? How do you make money right now? And obviously, I know all business models change over time, but right now, what's the plan, or how are you going about it?
Sure. HealthPrize basically has a software as a service model. So again, we're a online and mobile platform, and we charge our customers a annual license fee and then a customization implementation fee up front, because as I mentioned earlier, we customize the platform for the condition, for the patient population. In some cases, we have to change some of the business rules depending on how the prescriptions are written and that sort of thing. And so it's a fairly standard software as a service model. The rewards are also then charged to the sponsor of each program. What's interesting about the rewards, and again, patients earn points and then redeem those points just as you would, say a credit card loyalty program. What's interesting is that even if the program offers, say, $10 worth of points per month, the average patient doesn't earn every point or even redeem every point. So it ends up being a lot less expensive than you'd expect. You can offer a lot of value, but really have to spend relatively little.
Oh, that's great. So I got a question for you. When I bring you back in 5 years from now and we're talking about HealthPrize, what do you think you're going to be telling me?
I think we're gonna be expanding globally, which we've been shocked by how much interest we have beyond the U.S. And we're busy enough in the U.S., but people often say, well, this has got to be a U.S. problem because of the cost of drugs. It turns out it's not really about the cost of drugs. It's more human psychology, so it's a problem worldwide. And I think we're going to be selling to a greater number of healthcare constituencies. Right now HealthPrize sells mainly in the pharmaceutical space, and we're just starting to go into the payer space. But collaborating with major pharmacy chains is also very much on our near-term radar. And so, 5-10 years from now, I believe that we'll be reaching a much greater number of patients, and also, interestingly, across any form of drug delivery. So this is not just for patients taking oral pills. It's also for patients who need to inject themselves for diabetes or rheumatoid arthritis, or whether they have a topical treatment. So really, patients across all conditions with all forms of drug delivery would be our goal.
I think that's amazing. I love that your whole goal, your whole mission statement is you want to make taking your medicine, staying healthier, fun, and there's a prize at the end. And that, to me, is what it's all about. The prize is staying healthy, and a little reward is amazing. Doc, thank you so much for being on the show. I can't wait to have you back on the show, and everyone should check out HealthPrize, and I will talk to you soon.